So when I was a student, I did an elective rotation in an oncology department at a specialist hospital, and I really enjoyed it more than I expected to. And it made me think about what was available in first opinion practice rather than just at referral level. Obviously they can do some amazing things, but as cancer is something that can affect anyone's pet, I think it's really important for us to be able to offer as much as we can in a first opinion setting where referral isn't necessarily always an option. So I've had quite a few chances, because it is an unfortunately common thing for pets to have some kind of tumour or cancer diagnosis. Building up a caseload has been relatively straightforward. I've had quite a few cases now from start to finish, and I really enjoy the surgery aspect of it most. So not all types of cancer are treatable by surgery, but those that are particularly satisfying because you can see the problem, you cut it out, it's gone. Something that I'm looking forward to is I've got a CPD course booked being facilitated by the practice about surgical oncology and furthering my skills in that area. A typical day is very variable because we are a mixed practice. Most mornings we start with operations, so we admit our patients in the morning, make sure the owner knows the plan, get them into the building, and then we'll go ahead and do those procedures that we've got booked in. At any point during that, we never know when an emergency is going to come in, so that can occasionally derail everything. And then we have to prioritise based on welfare. But I enjoy the variety that comes with it. I enjoy that some mornings you find yourself going off to see a sick cow. Sometimes you're doing a lambing, especially springtime, and sometimes you're doing routine spays and neuters, and you never know what it's going to be. And then in the afternoon it tends to be more consult focused. Sometimes we still do ops if there's anything that's coming in the meantime and has to be done on the day. We see quite a lot of consults coming through. We have some booked in ones and some for our walk-in clinics. And sometimes it's just an in and out consult, make sure everything is absolutely fine and everyone's happy. Sometimes it's a case of this animal has several problems and we do what we can to either fix them or investigate them further. A big part of it when a pet has a cancer diagnosis is just being there for the owner. People will have a lot of questions and a lot of worries because a lot of people have personal experiences, either themselves or someone they know who has had a cancer diagnosis. So I think ultimately nothing I say is going to fix the problem for them. It's still a scary situation to be in, but making sure they have all the information and they know what's going to happen, what the possible outcomes are, just keeping them involved at every step of the process, I think makes a lot of people feel more secure about what's going to happen in the future. So for tumours that are appropriate for surgery, we can carry out a range of surgeries. The most common ones we address are tumours in the skin and beneath the skin because they are generally the most straightforward to remove, and we can also do some surgeries for internal tumours. Obviously we don't have facilities for complex staging that would be done at a referral hospital because that needs a lot of qualified specialists and equipment, but that is also a lot more expensive at that stage necessarily. So we are able to do surgical management, we are able to do some medical management, and we're also able to offer quite an extensive palliative care service where we make sure that quality of life is maintained. We talk about nutrition and pain management and day-to-day quality of life for patients. But even though it's often not good news and you have to tell the owner that, and that can be really difficult, you do get to be there for them in that moment and sort of help them through a really difficult moment. And then you do get those moments relatively often, which is nice, where you get to call them and say, it's good news, it was benign, or it was bad, but we got all of it out and it's not coming back. And that is the best moment.